CEN Test Prep Examples. Question 1. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A. The EtCO2 of 0 mmHg. Option B. Persistent EtCO2 waveform with each ventilation. Option C. PtCO2 of 50 mmHg. Option D. A flat line waveform. The correct answer is option B. Persistent EtCO2 waveform with each ventilation. Question 2. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A. Diltiazem. Option B. Verapamil. Option C. Metoprolol. Option D. Digoxin. The correct answer is option D. Digoxin. Question 3. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A. Albuterol nebulizer. Option B. Intravenous diphenhydramine. Option C. Intravenous corticosteroids. Option D. Intramuscular epinephrine. The correct answer is option D. Intramuscular epinephrine. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The emergency nurse suspects acute epiglottitis in a patient presenting with option A. Inspiratory stridor, drooling, and tripod positioning. Option B. Barking cough, low-grade fever, and hoarseness. Option C. Productive cough, pleuritic chest pain, and fever. Option D. A wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A. Inspiratory stridor, drooling, and tripod positioning. Question 5. The most common cause of airway obstruction in an unconscious patient is option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. Question 6. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high quality CPR and defibrillation. Question 7. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. A dry skin and absent bowel sounds. Option C. Hyperreflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is option C. Hyperreflexia, clonus, and agitation. Question 8. A Call's fracture involves the option A. Proximal humerus. Option B. Distal radius. Option C. Femoral neck. Option D. Tibial plateau. The correct answer is option B. Distal radius. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. Question 10. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 11. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid- position and fixed pupils. Option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 12. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects. Option A, open-angled glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 13. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 14. Fat embolism syndrome is most commonly associated with fractures of the. Option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Question 15. Priapism is a urological emergency characterized by. Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 16. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 17. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 18. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is. Option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 20. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to. Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 21. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 22. The priority patient for a trauma team activation based on mechanism of injury is option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Question 23. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain. Option B, a damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 24. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 25. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices.